all that weight's coming from the shoulders and your knees are shoulder width apart. Right, and you're compressing 1/3 of the depth of the chest. On these guys, you'll hear a click. Right, if your hand gets sore or you can't push that compression, just use a second hand. All right, I'm gonna do 30 compressions straight away. So 1, 2, 30. So after my 30 compressions, I deliver 2 breaths. Breaths are optional here in Australia. If you don't want to do them, you don't have to. But like I said, if this is your own child, you do breaths. 16% higher chance of survival. All right? Grab your face mask, pop it over the face, pinch the nose, grab the jaw, and tilt the head as far back as it goes, and deliver 2 full breaths. Do you guys see that rise and fall? Watch what happens if I don't tilt the head back. Anyone see rise and fall? No rise and fall. So it's really important to have that head tilted as far back as it goes. All right? Straight back into compressions. So you're going to do 30 compressions followed by 2 breaths, 5 cycles of that in 2 minutes. It's 120 beats per minute, 2 beats per second. Do you reckon you're going to remember that in emergency? Absolutely not. You're going to be like... All you're going to remember is 30 to 2. 30 compressions, 2 breaths. All right? That does not change the age of your patient. Right? So on an infant, right? On an infant, you need to have them on a hard surface. Right? If you guys have done a bless you, scared me.
Sorry.
Got a cardiac you guys have done a workplace first aid course before. Some educators will say you can hold bub in your arms like this. Right? All you're doing is pushing the baby backwards. You're actually not actively beating the heart. Right? So as hard as it is, bub needs to be on a hard surface. All right, so it can't be on a cot mattress or anything like that. Floor, table, something like that. All right, we're going to find the nipple line again. 2 fingers, compressing 1/3. All right, this guy doesn't click, but you'll feel like you can't push any further, and your hands come back up. All right, after about 10 compressions, your fingers start to get sore. All right, so I'm going to use my texting thumbs. The texting thumbs always stronger. All right, this is how paramedics, doctors, and nurses will do a resus on an infant. We'll hold bub underneath the armpits. Texting thumbs will meet in the middle. Gives you an alternative, all right, and you'll get a better compression out of it. So when you guys have a turn, I want you to try with both, just so you're comfortable with both. All right, what you're not going to do is use your knuckles or anything like that. All right, so 2 thumbs or 2 fingers. Now with your breath, what we want to do is put bub's mouth into a neutral position, right, which means their lips pointing to the roof. So it's no head tilt, so it's not too far back, it's not too far forward. We want those lips pointing to the roof. All right, the best way I can explain this to you, if you're watering your garden and then you kink the hose, the water would stop, yeah? Okay? If you tilt bub's head back, it'll kink the airway. Oxygen won't go through. All right? So you just want a neutral alignment. You put your face mask over bub's face and you hold them in that pistol grip. Right? Your pinky's resting on their chest, and the reason is this tiny baby. I might have my hair down or a big jacket, I might not be able to see that rise and fall. But if I've got my pinky there, I can feel it. All right? I'm going to put my mouth over nose and mouth and deliver 2 short breaths, just enough to fill my cheek. So, what that looks like. You guys would have seen that. I'll turn bub around so you guys can see, all right? See that small amount of rise and fall? That's all you'll see. Straight back into compressions. Right, so again, 30 compressions, 2 breaths. Right. Now on the adult, I'm going to show you ineffective CPR versus effective CPR. Alright, so I'm finding the nipple line on an adult. Alright, the number 1 question I get here is what if it's a female over a certain age who's been breastfeeding for a while? No, we don't do CPR on kneecaps or belly buttons. When a female's on her back, everything falls to the same side. So if that insults, offends anyone, please don't take offence. The ARC have said nipple line, and the reason is everyone has nipples and they're in exactly the same spot. So it just makes it easier for first aiders. All right? So finding that nipple line, 1 hand on top, lock it in, coming from your shoulder again, and other hand on top. All right? Now if I don't compress fast enough or hard enough, can you see that light, that red light? Slowly, that's symbolising blood, oxygenated blood slowly making its way to the brain. At the moment, I may as well lay down and spoon them because that's about as effective as it is. All right? But if I push hard and fast, you can see the oxygenated blood is keeping the person's brain alive. I'm working someone's 2 biggest organs, the 2 most important organs, their heart and their brain. All right? So 30 compressions. 1, 2, 3, 4, 5, 6, 7, 30. After for my 30 compressions, again, pinch the nose, grab the jaw, tilt the head as far back as it goes and deliver 2 full breaths. Right? And that's over the age of 8. All right? defib machines, have you guys seen them before? Yeah, where have you seen them?
Shopping centres.
Shopping centre, absolutely. Work, did you say? Where do you work?
A place in North Sydney.
Sounds lovely. Yeah. I'm from Melbourne. Is it like a gym or
Office.
is it office?
Office,
Great,
yeah.
that's great. Anybody else? Work,
Train station.
train station, airport. Did you say? Yep, perfect. If